So we have one person. Balaji Knight. Hi, Kamran. Hello, Naidu. So let's open it with the questions. You can ask anything that you want. Guru. Hi, Guru. Guru, yeah, I got your message. You want to discuss your resume. We will discuss it tomorrow if you have time, 12:30. Otherwise, uh, 7:38. Otherwise, 8:30. Okay. Sorry, I was not getting the time. But again, Kamran, unpaid internship, if you have time or if you don't want to apply for jobs right now, or you can, or you are pursuing your degree. First thing, if you are pursuing your degree, then you can go. If you have done your degree or your degree is completed, or you are just like looking for the job, then it is of no use. Because, see, uh, first, like, let's decide the use and purpose. Tell me what is the length of the internship? 3 months. Okay. So 3 months you will be working full time. Okay. Let's say throughout the day. You won't be getting time to apply and about work on your preparation. Second, this is the negative thing. First is the negative thing. Second, you will get exposure about clinical research. That is good thing. But is this something that you are looking for? You want to work in clinical research. Is this something that you want to go for, or you are interested in clinical research? And let's say, again, the first thing that I said, you have to make a note of it. You won't be getting time to apply for jobs that you are looking for, or to prepare for the interviews that you are looking for in the daytime, which is a crucial time to apply. uh, Name please, Raj. I will take you through Argus, LSMV, and Medra, and I will also tell you about Viva. Kamran, there is a question for you. In which company and location the internship call is? Naidu, you can start now. See, Kamran, that's what I'm talking about. Pharmacy, hospital jobs are good. Okay, but again, like I told you, you won't be getting time in the daytime to work on your like required applications that you are looking for. Rohan, which one is a better option after B Farm as a fresher for long-term growth, CRC role or PV job? Rohan, you yourself gave the question answer, brother. If you are starting at 15 with experience, you will get hike on 15. But if you start at 25, you will get hike on 25. So career growth or long-term growth, PV will be better. See, guys, this salary package is different at this experience level, okay, and should not be revealed in public like this. It is not allowed. It is, let's say, corporate breach of contract. I can't reveal, and it is not okay as well to reveal this. But I can tell you, I'll give you a brief idea. Okay, it depends on the approach that you take, or it depends on your comfort zone. Let's say if you switch along with time, you make comfortable switch, so you will get a higher package. Okay, but if you feel comfortable staying at a single company or long for a longer period in a single company, you will get limited number of hikes, or the percentage of your increment will be on the lower side. So long term stay at a company will fetch you a less package, but switching regularly or switching strategically to grow in the career will give you a higher package. Many people post notes so negative related to PV and salary growth. I didn't get it. Not so negative. Can you please clarify what does you mean not so negative? I didn't get it. You mean the many people post negative about PV? Oh, okay. See, first I have asked this many times. Kresha added, please can you mention your name so that I can call you by your name? I forgot if you mentioned in the previous streams. Sorry. Shrishti, yeah. Shrishti. So, see, many people, actually, the current scenario is higher entry level jobs are paying less. Companies are reducing the entry level job profile salaries because they are working on cost cutting. Okay, and the market is very volatile as of now, but for certain profiles and certain jobs, the entry level jobs, the salary is on a higher side for healthcare, not about PV. I'm talking about healthcare. In PV specifically, if you look at it, the entry level jobs are paying less. I agree with that, but in certain organizations, if you choose the right profile, you will get a higher package. What should be the duration of monthly recovery? Rohan, it depends on your feasibility and availability of the job as well. Staying in a company for two years maximum is more than enough. Yes, Kamran, you can mention that internship. You don't have to mention unpaid internship. You just can mention straightforward internship, and it will actually be valuable. Okay, uh, let's take CDM and PV. First, CDM and PV. It is just a matter of choice or toss. If you are interested in clinical research, go in CDM. If you are interested in PV, then go for PV. Shristi, see, Anthropic is they they are promoting their models. They are working heavily on agentic AIs, and I get it. I understand this, and there is a scare to the entry level job. I am not denying this. Okay, but it will take time to fully implement it. It will be in India, since everything moves very slow. So the entry level jobs will be replaced, but it will take time for at least 5 to 7 years. That entry level jobs will be like they will start replacing. The hiring will reduce, but there will be new roles. AI data analyst is a new upcoming profile in healthcare. If if the classical roles of classic entry level jobs will be replaced by AI, then there will be new roles. Rohan, if you are getting opportunity abroad, then you have to decide based on the locality, because the region that you will be shifting to or the region that you are looking to work into, they should be having those kind of jobs that you are looking for. Ganesh, see, it's a contract level job. Having a 6 month contract, I never appreciate that. You can, if you are not getting any opportunities, you can join. But I would suggest by the time you complete, because Fortria never continues the project contract, okay, they will not hire you or not give you a full time job. By the time you complete 4 months in that contract job, you have to start looking for other options. So by that, like, you complete your contract, and at that very point of time you should be having another job in your hand. If you can take this risk, then go for it. If you don't want to take this risk, then keep on applying. Nagajoti, how to start a career in pharmacovigilance. This is a whole session on my channel, you can watch that. It is similar for everything, not about a Farm D, B Farm, M Farm, Farm D, MSc, BSc, any life science, BTech, Biotech, anything. It is similar. The roadmap is similar. There's a whole session how to start your career. You can watch that. Guys, more questions, please. Okay. So, as mentioned in the group, Shristi, I am working on it with a team. Okay. I'm working with a team of 80 people around freshers. Okay, we don't even use the word AI in our day-to-day life or process. See, automation is there. I have mentioned this in multiple sessions. Many projects or many processes are getting automated. Case processing or data entry, they are automatic. This thing, okay, this is already there. Okay, so automation and implementation of artificial intelligence is being worked on. Okay, but again, it is not that much into process or impacting. People are getting hired. If you want me to guess a number, in the last 1 month, in the last 1 month, I have seen uh, 50 people, around 50 people getting hired as ops coordinator one at multiple locations in IQVIA itself. And after how many years we should do to ICSR so that we can move to another role like aggregate reporting. John, you can work on ICSR processing only for 1 year. After 1 year, you are eligible to move to other domains internally in the same company. You can't switch to other domain to other company. Hi Meg, hi Ayan, hi Rishu, Aniket. So yes, you can talk to Ganesh. Ganesh can help you out with the questions and everything. And like I told you, if you are not getting the any opportunity and you want to go for the exposure, choose the contract job, but make sure by the end of fourth month you have already have your job. You have to keep trying. Yes, Pratik, you can. Guys, I would again request everybody, if you are going for interviews or somebody cleared the interviews, if you can't share or don't want to share, do help with other people, like sharing the interview experiences. And Shadri, if you don't have campus placement, then you are just like any other people. Just update your resume and start applying. KF, the highest post in PV is that you can reach vice president if you are working in any company. But if you, with experience, you have gained significant experience and you have been in the field for long time, you can even start your own company. Rohan, this duration, this depends on company to company. Some companies give promotion in 1 year, some follow 1.5 years, some even follow 2 years. Your see that is again choice. Real world analysis, brother. Again, if somebody is interested in RWE and all this data, then they can go for here. It's see, Farmaster John, and to everybody in the stream, I'd like to again specify that field is not the option or not the, let's say, problem. The domain is not never the issue. It's not about something is better than others. I have told this multiple times. There are many successful people or many freshers who reach to significant positions in a particular domain, whether it's BPV, clinical research, regulatory affairs, real world, your whatever you call this, or artificial intelligence, IT sector, and everything. Kev, every job is stressful. People on government jobs are also stressed, brother. It depends on you how you handle the stress. Despite being promoted within one company, what if after working as CRC for 1 year then building a skills knowledge for CRA? Yes, Rohan, it is very much practically possible. And people do that. Smart people follow this approach. Okay, this study have said after 1 year, if case person will be able to move the. It's it's always better to do certifications. Even if you have completed 10 years in a company, if there is a new certificate that can add value to your profile, you should do that. I also myself do that. Right now, currently, I'm working on three certifications which add value to my profile. Learning is always it's an ongoing process. You should always learn new things. And I told you after 1 year, spending 1 year in a single position in a company, you become eligible for switching to other position, other project, other domain within the same company. Don't get it wrong, okay, please. Come on, guys, more questions. Okay, but what other ways we can apply as a fresher sales like IQ? Anjali, since you are in your final semester, you should not be applying first thing. Second, workday portals and getting a reference. There are the rest two ways. After joining 3 months PV or clinical research online training program, which goes. Oh, Rohan, straight and like straight answer. No, it is of no use. It is not worthy. You want to ask this question, you can post this question within the group itself and let people who are working on the workshop, who have joined the workshop, and many people in the group will answer your question. No cap. Eh, Anything. Uh, it's not like the paid course will give you an edge. No, if you have the required skill set, that will give you more impact. If you can impress the interviewer with your skills in the interview, it is never the case कि मैंने 1 लाख में डिग्री करी है, उसने 50,000 में की है, तो 1 लाख वाले को प्रेफरेंस मिलेगा नहीं. Yes, it is the case. Every company, not a single company, every company. Priyanka, it depends on your choice. If you like medical coding, then it's a good career option. There are many successful medical coders you can find on LinkedIn. And about the targets, yes, every company gives a target that is based on the target completion of the work. Like your performance will be analyzed for increments and further progress in your career. The last one, I think, the last one, signal management. Because aggregate reporting and signal management, they are both hectic, but aggregate reporting and signal management are the most specific domains which will be least impacted by artificial intelligence. And you have to find out why and how. Rohan, uh, let me discuss this. We have less people now. I don't know why. Let me discuss this point with everyone. Okay, stay with me on this. Huh? Let's say we have Anjali. If Anjali is there, Anjali, please raise your hand if you are here. Let's say Anjali is in final year. Okay, she is completing her degree, and she don't have any paid certification. Okay, I have guided her to follow few free certifications and let's say do some courses on Udemy or anywhere, and she's completely like following her instincts and her skill set. Okay, and she got a call. And Rohan, you joined an institute, you took a 3 months training, hands on everything and everything. You also got a call, and you both cleared the interview. Okay, you both cleared the interview. Would you give your institute board program a thumbs up that it gives you a edge? Skills come with experience, Gav. With experience you will learn new things. It doesn't matter if other person is master. See, post graduation gives you edge at the very beginning of your career because multiple CROs only prefer masters only. Okay, that gives the edge. Otherwise, there is no battle, nothing. You learn, you grow. That's it. If you must have seen, no, many people in the group were hired as ops coordinator one. So there are masters, B Form, PharmD, BDS. These four qualification people have joined as ops coordinator. Same position, same salary, same company. So what do you think? After 2 years, which one will grow? जिसने ज्यादा सीखा वो ज्यादा आगे बढ़ा. Ron, that depends on the course certification. It is not about certification, brother. It is about you. You have to gain the knowledge. The knowledge is open. I have if you let me make this statement. If you watch all the videos on my channel, no, okay. If you watch all the videos on my channel, you will be able to clear the technical round of any interview. You don't even need a certification. I'm making this statement, I'm making this claim. If you just go and watch every video on my channel, you will be good enough to clear the interviews. But you have to follow. It is up to you how you gain that knowledge or how you incorporate that knowledge in you. And I am making this claim because this has happened. I have helped multiple people in the past 6 months without any paid certifications. And the reason I'm conducting that workshop is to help you people avoid those expensive paid courses. And you say hands-on experience. I can tell you how Argus work. I can tell you how LSME work. I can tell you how Viva works, and I can also tell you how Medra works. Okay, and I can also refer you to IQA, that is placement assistance. Okay, so and I'm not charging 25,000. Nikita, we have discussed this. You have joined late, I guess. There are two more people over here who has got offer letter for contract jobs. See, I have I posted a specific video about this. Okay. See, contract jobs are good for exposure if you don't have any option. But if you are looking for a long term job, okay, if you are looking for a long term job, then you should keep on trying for the long term job. You can join the contract job for exposure. By the time you are completing 4 5 months, start looking for other options. And by the time you end your contract, okay, by the time you end your contract, you should be having the job. Otherwise, you will be back to being a fresher. Rohan, that is the problem, na, bro. Strategy. It needs a strategy. See, this is the reason. I'll reveal that reason to the reason I started that workshop right now at this point of time because the hiring season is going on. Okay, we companies are hiring. If and I want to help you guys clear the interviews. It is the correct time to clear the interviews. See, you have to understand this. You are applying, you are not getting calls, that is not harming your chances. Okay, but what if you got a call, you go for the interview and you get rejected during the interview? That will impact your chances for the next 6 months. And then you will be sitting at your home thinking, I could have prepared better. And the problem with nowadays with many people, they are okay paying for 25,000, 30,000, 50,000 of their parents' money. And I am giving the same knowledge. I am trying to give the same knowledge. See, it is very much difficult for me to take out 2 to 3 hours of a day to conduct those workshops. But still, I'm trying to manage that. And I'm charging for the resources that I'm provided. Okay, and people still feel problematic because then they will expect, like, sir, you are charging this, we expect a certification as well, and we expect this and that. They don't value the knowledge that they are gaining from this. They will see in 25,000 or 30,000, 35,000, they will get this certificate, they will get that certificate. Bro, when you join the company now, nobody will even ask you what certificates do you have, because nobody cares. Kev, I'll try to talk like you message me on WhatsApp. Okay, I'll try to talk one of my friends. But again, my friend is in Baddi, Himachal. Is there specific role in masters from top institute like? Kev, this is not the problem. Okay, you can do whatever you want in your degree. You just have to have the knowledge required for the job. It doesn't matter if you are doing master from Niper and you are getting campus placement. You will start just like another fresher, but the package will be on higher side. That's it. Rohan, if it's good that you're clear with this, but again, many people in the group are not. See, I have posted this like this stream. There are only 18 of you are joining. We have more than 1,000 people in the group, and this loop of this question, that paid courses, degree, that this will continue. This will go on, continue on, like continuously. This question will come up. That is the reason I have started like answering this, like how to start my career in PV. Guys, I have mentioned this. There are 3 videos on the channel, how to start your career on PV. 3 videos. The information that is shared in those videos you will not find on any channel. But again, people join, the same questions will be there. You ask this question, and somebody in the group has who has not joined, they will again ask these questions. That is why I need your help, no, to increase the reach. Whatever you are doing, share this information, share this data, share this group, share this channel with your colleagues, friends, teachers, so that it can help them save money. Yes, Nikita, that's why I said if you're not getting any opportunity, uh, okay, you can go for it, but please keep trying. Don't like stay stuck on this. Depend if you are in the group two, I will share the details again. Rohan, see, this does happen. Actually, I'm not denying this. This does happen, but for certain locations only and certain profiles only. Depend you, I'll share the workshop details, brother. It is not entirely true. It is not about candidates getting rejected. I have mentioned in the group like what two people, two to three people have joined IQVIA Kolkata office. One is from Maharashtra. She was not local. From Maharashtra, she has joined Kolkata office. Many have joined Kochi office from other states as well. And if you like, let me give this option as well, no, about the institutes and paid courses and everything. Whenever I post about someone getting selected, reach out to them and ask them, have they done it? Like, did they do any paid certification or diploma or degree and whatever do you want to ask? Reach out to them, see their resume, and then update your resume accordingly. And many people who are getting selected right now are following or get in touch with me from the very beginning. I had a mock interview with Anjali. So I Anjali knows me, like we have a discussion on LinkedIn. She's connected with me for more than 6 months now. I guess. Yes. You will be asked this question, are you ready to relocate in the interview, Rohan? You can answer that yes. Otherwise you can mention in the resume as well. It is not a problem. Uday, again, you are you are joined from Ron, you have joined from what? LinkedIn. Okay. Uday, there is a interview, mock interview video on the channel. You can watch both of them and you will get your answer. Let me see if I can share. Uh, we have any place in the first group? Yeah, we do have two seats in the first group. Let me share. Oh, we don't have. Copy. Ron, this is the group link. The Bendu, uh, in the assessment, there are questions related to pharmacy, biochemistry, and your pharmacy professionals and everything. More about biochemistry, UV spectrometry, पता नहीं, like whatever they ask. You can reach out to people in the group who have been selected as ops coordinator or working in IQVIA or joined IQVIA recently. Many people have gone for interviews at IQVIA. And assessment based on like many questions related to biochemistry and again pharmacy related, nothing else. You need around 38 to 40 marks to qualify with the assessment. Any more question, guys? Come on, it is going fun. Come on, guys, we are open to questions. What kind of Divendu, to answer your question, yes, nowadays every company is conducting the assessment, and not every, but maximum companies are taking the assessment, but their assessment differs. And medical science liaison, Pratik, that depends on the job description, buddy, you are looking for. Like the job that you will be applying for, there will be job description, and based on that, you can decide. Sai aggregate reporting is scheduled, brother, but again, nowadays, actually, the reason that the videos are on the like fluctuating because many people are requesting for the mock interviews, and I have started the workshop as well. So I'm not getting time to work on the videos as of now. But again, aggregate reporting videos are scheduled. I already have the script prepared and everything, but it will take some time, not a lot of time, but some time. Yes, Rohan, Operation Coordinator 1 is an entry level PV job in IQVIA. It's a company specific profile. Operation Coordinator is a IQVIA specific job. Questions, suggestions, requirements. Come on, guys. Shivraj, it's like it's this question I have we have discussed multiple times. The shorter the CV, the less there the questions are. It is okay if you have two-page CV, okay, but you should know what is written on your CV. You should be thorough with everything. But if like if you have a smaller or shorter CV, there will be less question. Uday, you should focus on pharmacology knowledge. If I don't know which I don't if you have any if you want to reveal the company that I can be specific, you have to be sure about pharmacology knowledge and basics of pharmacovigilance. That's it. If you are talking about interview and not the assessment. The only thing that is required is pharmacology and basics of pharmacovigilance for any interview. Guys, more questions, please. Yeah, so there, if the company is like, let's say, like IQVIA, Fortria, or any other company, just focus on your basics. No, Rohan, it doesn't depend on the role. If you are interviewing for it per Excel, they ask assessment questions based on logical reasoning and math. In IQVIA, they are more specific on pharmacy and any other company as well. They ask questions based on pharmacy knowledge from the pharmacy curriculum. Which classification? Shuraj, which classification? That it depends on the interview, brother. They can ask anything. Classification, antihypertensive, penicillins, antibiotics, they can ask anything. How I can suggest you one thing? Like, no, diuretics, these are common, like, whatever the common classifications are, they can ask anything. And it is not important that they will ask. No. Rishu, to answer your question, भाई एक साल तक if you can help me remind, like keep on remembering you, because if I share my WhatsApp screen in front of you, I it is not possible for me. Pharmacology, Divyanju, it's pharmacology. Harshit, bhai, you will not get time to work on anything. If you have time, you will be smart, and you should be smart enough. And you can work on, like, see, in first year of pharmacovigilance, when you work on, well, learn case processing, then after that, learn the process, try to learn the business aspect, how the project work or how the project functions, and then choose a domain, specific domain that you want to grow in this. Okay, then you can go for it. Rohan, again, I have answered this multiple times, brother. It is not about the domain, it is about the person. If clinical research makes you happy, then clinical research is the best option. If PV makes you happy, PV is the best option. I was clear since my master's that I want to do PV. I am working in PV and I am very happy. Pratik, it is not about questions, it is about assessment. Parexel conduct logical reasoning assessment, just like government exams. Yes, it is a assessment, multiple choice questions assessment, specifically in per Excel. It is very much true, and that is why it is difficult to crack the per Excel assessment. Depends on the position that you're looking for. It must be available anywhere. Like if you are looking for a senior position of 5 to 6 years, I saw one in what Hyderabad location and also Thermo Fisher and Prime Vigilance and in Delhi too. If you want to know about experience vacancies, then talk to the people working in the companies to check if there is a vacancy, because sometimes companies don't post that. They tend to hire internally as well. If somebody can refer you, it will be easy for you to get the job. I see many people have joined the group, and I would request every new member, like who have joined recently, to do check out the channel and subscribe as well. Come on, guys, last 2 3 more minutes. Ask questions, whatever you want. No more questions from anybody. Okay, there are more. Pratik, it is tough to get a content, because I would suggest you can go through any government exam book, aptitude book. That's the same will be there. It will give you an idea. Rohan, it is I understand this, brother. See, we have discussed this relocation part multiple times. For the first year, when 10 years ago, I also relocated a very lower salary. Okay. For the first year, it is always family support. You will need your family support. It will take you an year to understand the finances of your salary and everything. And then you will be able to think about saving. Take a PG, share room sharing, like reduce the rent per like thing. Then depend on company food and like how to manage food and expenses and everything. So it will take you an year to understand all those aspects, and then you will be able to actually save on the lower package as well. For the first year, first or at least 2 years, it's a struggle, and it is worthy. No, food options are always there at a price. Like in IQVIA, they do provide one-time meal, which they like charge from the salary at a very minimum amount. Like let's say 50 rupees per meal, and snacks and coffee and biscuits and everything. Like they many companies do provide. Many major companies share like 2 times meals and everything. If they work in rotational shifts, then 2 time meal is available, lunch or dinner and breakfast or lunch, depending on the shift. and they are charged. Many IT companies they give it for free, but many CROs, pharma CROs, they charge for the food and facilities. Medical surveillance, medical surveillance associate. In which company, brother? See, it's a fancy term. Okay, it's not like that. That it will be different from drug safety associate. Medicals are they must have launched it recently for the clinical trials because it is more relevant related to clinical trials only. Medical surveillance thing. They pay good actually. It is more of a clinical research profile and it's with a good pay. If you are getting this opportunity, go for it. If anybody in the stream is watching this, if they are getting this opportunity, go for this. They pay good actually. Clinical research jobs for certain clinical research profile have a higher starting package, and it is a good option related to clinical research. Always welcome, brother. Now it's up to you. Recommend my channel to others. Thanks, man. Drug safety associate offered comparison in terms of salary or work. Work is similar, salary is kind of different. Thanks, Raja. Does help me like again. I don't want to behave like a YouTuber or something. Help me increase the reach. Okay, I am looking forward to help many people. I have already helped a lot of people to get hired, like individually also through WhatsApp, YouTube, any mentoring also. But I need your help to increase the reach so that people avoid making mistakes and it can help them save some money on unnecessary paid courses. Okay, then. Are there any more questions? That is it. Thanks, Raja. And Rishi, the long term career is one from necessary or experience meant. Experience always wins. Don't switch. Don't switch. If you're getting an opportunity, then you can. Otherwise, don't switch. Thank you, Rohan. And for 2 years of QC experience of what? In manufacturing, no, your experience will not be counted. Hardeep. Come on, guys, more questions. Let's continue till 12. We have 7 more minutes. I'm open in PV domain. Am I open? Yes, you can join as a fresher. Your experience will not be calculated. No. Rohan, the answer is no. Clinical research in a CRO is a good paying option. They start with a good salary. In hospitals, no. Yes, Rohan, in certain companies, in remote jobs are available for PV. Come on, guys, last 5 minutes. If there are no more questions, we can close. If there are questions, go ahead. We have last 5 minutes. Guys, whoever joined from LinkedIn, please. No, Raja, it's not a good option. Never go for born in a hospital. No, 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 no. CRO. CRO is a company, Dibyandu. CRO, Contract Research Organization. Example, IQVIA, Cognizant, Parexel, everything. They are CROs. CDC, these are centers. CDC and CDM, they are. CDC is different. CDM is a domain. Yes, Crick Gangster, not due to AI domination, but market is volatile. No, Kamran, the 23rd March batch is open as of now. We need more people. Yes, Raja, many people are getting hired without a referral. If you are not in the group, stay in the group. You will see. Recently, how many I have posted about to join, they got there without any referrals. Yes, Rishu, it's see, Rishu, Abhi, you should focus on your degree. Don't go for this. You will get this knowledge later in your career. 15 days. Kamran, see, there are 16 people on this stream, and I can make one claim. Okay, in 15 days, I will make you interview ready, depending on your efforts. I will give you the basic clarity of everything. You will know how PV work, clinical research work, or how the CROs function. Okay, and you will understand what they are expecting in the interviews. I will give you one-on-one like mock interview, and I'll sit with you one-on individually to update your resume, and I'll make you interview ready. I will guide you about free courses, about paid courses, which is important, which is not important. And even I will give you practical knowledge about safety databases as well, including Mentra. And I take this challenge in a 15 days. That is why I said if anybody is not satisfied, the fees is refundable. I don't want to brag about it, but I have been training people from the last 8 years. I know what it takes. Throughout my professional journey, I have trained more hundreds of people. Save money of what? Rohan, I'm talking about the workshop, brother. The 15-day workshop that we recently started. Gangster, that's what we were discussing right now. Paid courses are not required. If you can get free courses along with the skills, that is more than sufficient. The workshop in place is a different thing. Okay, that in that I give you idea about your career, the basics of PV, how PV functions, how CROs function, and how the jobs are there, how companies hire, what is the process. Bro, it's not a, see, it's about genuine trust and everything. I trust my knowledge. That is why there are more than 15 people who have already started. Okay, and I take daily feedback. I give them opportunity to speak. I take their suggestions if they need improvement with anything. Okay, so झूठ बोल के करना है तो सिंपली 2,000 रुपये बचा के ना तुम अमीर हो रहे और 2,000 रुपये से ना मेरे को कुछ फायदा हो रहा. I earn well enough. The charges that are there because first I'm giving you a paid, very much like advanced book resources, okay, and I am charging for the time and effort. I am very much like confident about my knowledge and skill set that I'm giving, and you can ask in the group, like if you want to be, like if you want to take a feedback, whoever has joined the workshop, I will ask them to post feedback, till now feedback in the group as well. Raja, I am from Haryana. Okay, I guess we have closed the time. Any more questions from anybody? Guys, any more questions? And Kamran, I would suggest you, if you want to see my, like if you have not seen, Rohan, okay, I'll tell you, one evening batch is going on. We have class 4 sessions already scheduled. One morning batch we started today, only one. If anybody is interested in the evening batches, I have opened a slot of 9 to 10 p.m. They can reach out to me individually. over WhatsApp, not here. And if you join, if anybody is interested in like 6 to 7 or 7 p.m. batch, they can like again wait for 23rd or 4th of March. Naidu, you can message me on WhatsApp, brother. I have shared the WhatsApp link on the chat. You can join the group and you can reach out to me on WhatsApp. No, Rohan, I have just started this month only just to give you a heads up or let's say advantage in the hiring season. It will not be a monthly or repeatedly. As long as the hiring is going on, the workshops will go on. It is not a repetitive thing. I don't have a lot of free time. I do it because I like it. Kamran, it's a 15-day workshop, and till now there are two batches going on. One in the morning, one in the evening. The morning one started today only, so you have not missed much. If anybody is interested in joining the morning batch for 11 to 12 in the day, they can reach out to me. If anybody is interested in evening time, like 9 to 10, they can reach out to me. But I need five people. Like there has to be 5 to 6 people. Otherwise, there will be no batch. You have to wait till 23rd to complete for them to like the current batches. Kalyani, for experience, it will be of no use. It is for just like I'm just right now. I was focused on feed like freshers only because the hiring season is going on and every company is looking for freshers. We can have a discussion about experienced people. What are your expectations? We can have a discussion like separate call. How to get interviews? Gangster, how to get interviews? Again, brother, apply through workdays, send emails and everything. And if you are not getting anything, then try to get a referral. If you are confident, Rohan, then you should. If you have it like confidence in them, you see there's good feedback from others, go for it. But certification, again, Rohan, that what is the value of that certification? Every other company or every other person is now distributing certificates. What is the benefit? Is that certificate industry accepted? No. I can give you a certificate. Will that be industry accepted? No. Certification is not important, Rohan. You have certification, that's good. You have knowledge, that is better. Certification just gives up, like let's say add-on or let's say making sure you know something. It's a good thing to have, but it is not the whole and sole requirement of anything. Guys, any more questions, please? And whoever has joined from LinkedIn, please request them to like subscribe to the channel as well. Thank you. Yes, Kamran, it is on Zoom. About the workshop, you can reach out to me on WhatsApp, please. Okay. Any more questions, guys? Come on. Guys, we have more questions. Okay, I guess there are no more questions then. If there are no more further questions, we can close. Sure, Ron. For further questions, we will connect again. Soon there will be a session about medical writing that is scheduled apart from those workshops. Okay. I'll share the link. Whoever want to join can join. Otherwise, if you have any queries, you can always reach out to me on WhatsApp. But do give me some time to respond. It is not possible for me because again I'll receive a lot of message on WhatsApp. It is not possible for me to address everybody on time. Okay, do expect some delay. Sure, then if there are no further questions, I will close this call. Thank you. Hope it was worthy of your time. Do share your feedbacks on. Do comment under this video. Okay. Thank you, guys. See you later.